name's Paul Connolly. I'm Director of the NIHR Global Health Research Group on Early Child Development for Sustaining Peace. That's our official title that the funder has asked us to use. We're delighted to have the opportunity this morning to share with you some of our work as an international network. The presentations you've already heard from this morning from Dr. Ema Salah and Dr. Pia Brito have done an excellent job in really laying the foundations for this vision that early child development and investment in ECD can lead to sustainable development and to sustaining peace. And what we'd like to do in this session is to provide you with some examples of how collectively across the globe we're trying to turn this vision into reality by working in a number of countries impacted by violence and divisions. As the slide indicates, our group is funded by the National Institute for Health Research in the UK and also by UNICEF. As you can imagine, we've struggled with the very long name, so we've developed a shortened name, and we just talk about ourselves being the Links Network. And there's a website address there. It will be online within about the next week or two. But we've used the notion of links to really underpin what we're about creating links at all different levels. Most fundamentally, the link between early child development and social cohesion, but also through our network, linking research and professional practice, linking the different sectors of health, education and social services, linking evidence and program design, linking parents, caregivers and ECD providers, communities and governments, and of course, most importantly, linking people working in very different contexts and countries across the world. Links, then, is a research network, international network of researchers who are supporting the development and evaluation of ECD services in low and middle income countries, particularly those impacted by divisions and conflict. And in line with the previous talks, our work is driven by a collective belief that ECD programs and investment in ECD services is not only essential to be an underpinning element of creating sustainable development for countries, but it can actually lead also to promoting social cohesion and sustaining peace in countries. We're currently funded through the National Institute for Health Research to work in 6 countries, and you can see them listed here: Mali, Egypt, Tajikistan, Kyrgyzstan, Vietnam, and Timor-Leste. And you'll hear more about each country and what we're doing in each country very shortly. But in addition, we're very keen to expand our network to bring in further countries and partners. We had a terrific meeting last week in Bogotá in Colombia, and we're working on plans now to bring in funding to enable Colombia to be one of our partner countries. And we also have plans in the new year to visit our friends and colleagues in Palestine and in Israel to do something similar. So we are a very ambitious and growing network, and certainly if you're interested to learn more, please do get in touch with us. Our broader structure, just to say very quickly, the network is led by a team of ourselves at Queen's University in Belfast. It's a strategic partnership with UNICEF, not just UNICEF HQ in New York, but we're working extremely closely with UNICEF country offices in each of our partner countries. We're also working strategically with local universities and research institutions in each country, and our work is supported by global experts in ECD. Global experts here at Yale, at Harvard, at New York University, and Early Years, the Organisation for Young Children based in Northern Ireland. You'll hear shortly about our work in each of the 6 countries and what we are trying to support in terms of ECD services. You'll see that the programs we're developing are very different. They have a different focus. The nature varies from one country to the next. But they all focus on the ultimate goal of ECD contributing to social cohesion and sustaining peace. And what ties our work together, and what we're really struggling with, but we're working through, is a theory of change. And Pia set out very wonderfully that broader theory of change and the science behind it. We've tried to convert that for ourselves in terms of programmatic design, in terms of this classic logic model. And if you get to my age, maybe your eyesight is not going to be great at the back, so you may not be able to read this fully, but the slides will be made available. But I think if you just get an understanding of what we're trying to do, we've set out how we see investments in early childhood, typically by government, leading to activities in terms of the development of ECD programs, how those outputs, those ECD programs, can lead to short-term outcomes, positive change in child development in the lives of caregivers and parents and families and communities, and then fundamentally how those short-term outcomes from ECD programs, we can build upon those to lead to long-term sustainable development, increased education, increased employment opportunities, reduced inequalities, and most fundamentally for us, social cohesion. And what we've tried to do in this logic model is to set out from our collective experience and our understanding and the existing evidence about the nature of those activities at each stage. So it's not just that governments need to invest in early child development, but for example, you'll see here, they need to also directly recognise divisions and conflicts in their country and have that explicitly as part of their goal. The lights have gone down, I think that's, and they've gone up again, that's good. You'll also see, if we move across, and from our experience across the globe, when we're developing the activities to develop ECD programs, they need to be inclusive. They need to be in partnership with parents and communities. They need to be co-produced. And then in the delivery of programs, we know time and again, it's already been mentioned, the importance of involving parents, involving fathers, the importance of ECD programs recognising and reflecting and honouring diversity and difference. So really what we've set out here then is an overall sort of framework for change, which is a starting point for each of our countries. But our focus ultimately, as I've mentioned, is social cohesion. And you'll see, if you can read the bottom right-hand corner, we understand social cohesion in different ways. There's horizontal cohesion, and that's the developing of relationships between groups, between communities that are often have been divided, and in civil society more generally. So there's horizontal cohesion we need to be aiming for, but also vertical cohesion, the relationship between civil society in all its forms and government. And what you'll see here, if it's thinking about, well, what does that mean in practice? Well, we've identified with the support of our partners at Harvard Humanitarian Initiative, key domains of social cohesion. So whatever we do, we're looking at, whether it's horizontal or vertical cohesion, we're looking at increasing trust, increasing participation and community engagement, reducing social differences between people, improving relationships, enhancing support and social solidarity, and enhancing and building a positive sense of identity, of belonging and inclusion amongst everyone. So that's our overall framework, it's our starting point. What I'm now going to do is to pass over to my colleague from Queen's, Sarah Miller, who's going to then talk through each of the countries and give you a sort of a snapshot of the programs in each country and how those programs, how we see those programs mapping onto this logic model. So, Sarah.
Good morning. I'm going to give you a very brief overview of the early childhood programs being implemented in each of our 6 countries who are represented here and who are taking part in our project, including a small amount of information about each program's aims, specifically in relation to social cohesion. The panel discussion that's going to take place after this will provide more detail and more context and insights in relation to the context in which each of these programs is being delivered, but this shall hopefully provide a bit of a flavour for you. In Mali, we have the Mama Yellen program, and Mama Yellen translates as Mothers of Light. It's a community-based program in which women from the community are trained to provide advice and support to new and newly expectant mothers. The program's overall aim is to establish a caregiving community and to improve positive parenting practices. It includes the delivery of public health messages around feeding and vaccinations, for example, as well as positive parenting messages. It includes both home visits and group sessions where mothers come together to learn from the Mama Yellen. You can see here the logic model that Paul has just outlined, and in each of the countries that I'm going to describe to you, the elements of the logic model that each program aims to address and the outcomes that it aims to impact are highlighted. I'm not going to go through each one individually, but I just want to draw out some main points. So in terms of the Mama Yellen program, it is how the program is delivered which addresses ethnic diversity and social cohesion. Bringing women together from different backgrounds, including class, ethnicity, culture, the program aims to foster community engagement, reduce social distance, and improve relations between different ethnic groups, and increase support and solidarity within and between communities. In Egypt, home-based nurseries are the primary vehicle for the intervention. The aim of these home-based nurseries is to provide quality, large-scale educational services to children aged between 0 and 4 years, but also allowing Egyptian women to access the labour market and children to develop their cognitive, social and emotional skills. It is this community engagement aspect of the programme that seeks to transform relationships, promoting solidarity and support to serve the community and children. It is about the community and the government sharing responsibility with the aim of improving community engagement, enhancing support and solidarity, and increasing the trust between communities and the government. In Vietnam, the Holistic Parenting Programme is part of the wider Integrated Early Childhood Development Programme that is being implemented there. The Holistic Parenting Programme is delivered to parents of children between birth and 8 through community-based parenting clubs. Parents attend 8 meetings over a period of 4 months, which aim to improve parenting skills and child development outcomes. In Vietnam, the government have agreed and are very aligned to the importance of social cohesion, and it is already threaded through many of their policies. The government has adopted a nurturing care framework where health is as important as education. Thus, the main purpose of the Integrated Early Childhood Education Programme is to promote community engagement and enhance support and solidarity within families and between communities. In Kyrgyzstan and Tajikistan, these 2 particular countries are implementing 2 different but related preschool educational programs based around specifically commissioned episodes as part of a national cartoon series in both countries called The Magic Journey in Kyrgyzstan and The Magic Box in Tajikistan. The cartoon episodes seek to specifically promote awareness of and respect for diversity. The media messages are supported by an early childhood education curriculum, training and support for teachers, and a parent support programme as well. The 2 programmes are each focused on a community response to diversity and inclusion. They're based on mobilising communities by equipping parents and children with the necessary skills and abilities to recognise and challenge prejudice and divisions. These 2 programmes are particularly distinct because of all the 6 interventions, they have the most explicit focus on celebrating diversity through education. In Timor-Leste, community-based alternative preschools are being developed and provided where there is no existing preschool provision. Communities are playing an important role in the development and running of new settings, which are led by volunteer facilitators from within the community. A parenting support programme now runs alongside the preschool provision to improve parenting practices. It is this combination of the mobilisation of the community to work in tandem with the preschool provision that aims to increase community engagement, enhancing the support and solidarity experienced both within and between families and communities, increasing the level of trust in the government on the part of communities, and decreasing any social distance between different communities and regions. And just finally, I hope this has given you a very small flavour of the type of ECD programmes that are being delivered in each of the 6 countries so far involved in the project. Through the panel discussion that will now follow, you'll find out more about the context of each country, the content of each programme, the mechanism of change and the relevance of each programme in terms of enhancing social cohesion within the communities in which they are delivered. Thank you.
So just before we turn to the panel, just to pull together this first part of the overview of the network, we are funded in the first phase for 3 years until mid-2020. And we have ambitious goals that we want to achieve over that time. And we just highlighted them here to give you a sense of where we're heading in a sort of broader way. And there's 4 things that we are going to achieve by mid-2020. The first is that through our work in each country, through refining the logic model, through identifying and testing and developing new indicators and measures, we are aiming to have a sort of a measurement tool and evaluation framework developed and tested and road tested in different countries by mid-2020. And we want to make that, and our pledge is to make that freely available, to be a resource for those working in ECD in countries affected by conflict and divisions, to guide the work that's going on. So that's one big goal that we want to achieve through this first phase of our network. But also through working in partnership with countries and undertaking rigorous evaluations, we want to add to the evidence base that Pia set out so clearly. But as Pia has said, there are gaps. Some of our evidence is thin. Our different models that we've been trying out, we don't know necessarily which one is the most effective, in which contexts and for which groups. So we hope over these next couple of years to be adding significantly to the international evidence base for ECD for social cohesion. But thirdly, and most importantly, actually working in countries, we want to make a change now. So we're not just looking ahead about what we want to deliver in 2 years' time, but we want to deliver change now for the children that we're working with, for the parents, the caregivers, the communities. We are developing early childhood programs which are evidence-based, which are informed by our best understanding and our expertise about what is likely to be effective and work. And we have real belief that many of the programs that we're developing now and piloting and testing will lead right now to positive change in those countries that we're working with. And finally, we want to grow and develop this network further. It's been an absolute privilege as Queens to host the network, to facilitate it, but the real expertise is in the network, are the people and our partners and friends here today, sat before you, who will be speaking very shortly. And it's just a wonderful and productive context and setting where people can share their anxieties, their problems, their issues, their solutions with one another. And we've seen such great cross-fertilisation between countries. And we would like to have an opportunity to grow the network, to invite more countries in, more partners, so we can really become a global learning network. But my job is done now, but I think the most important aspect is to allow the people who are working in the countries, the partner countries, to speak for themselves. So I'm going to pass now over to my other colleague from Queens, Laura Dunn, who's going to sort of lead a panel discussion. Thank you very much.